Kia ora koutou katoa. Thank you for attending today's briefing. Once again, there are no new cases of COVID-19 to report in New Zealand, our 12th consecutive day with no new cases. So our total number remains at 1,154. We also have some probable cases, so the total combined and probable cases remains also at the same number, 1,504. There is still the one active case, which you're aware of. No one in New Zealand is requiring hospital-level care for COVID-19, and yesterday our laboratories completed 1,262 tests, our grand total now being 283,525. An update on the NZ COVID Tracer app. Now recorded 487,000 registrations. I'd like to continue to encourage as many people as possible to download the app. It will continue to support our contact tracing efforts, including when we move to alert level 1. I also want to acknowledge again the work being done by businesses to register for and download the QR code to support people signing in to their businesses. And the latest figure is that there are just over 29,000 posters having been created, representing more than 17,000 businesses and organisations. And to date, people using the app have downloaded the codes just over 496,000 times. And scans are being done each day, and that continues to increase, which I'm very pleased about. And just on businesses, the process for registering for a New Zealand business number and then going through the process of getting a QR code was a slightly lengthy process, so we now have a much quicker workaround. There is a link on the COVID-19 website or on MB website that takes it directly through to another process which is much quicker, and the Ministry of Health will generate a PDF of the QR code and send that out to you. So there are two ways that can be done now, the second, more recent one, being much more expeditious. Just a word on testing. You'll have noticed the numbers of tests have dropped over the long weekend. We've seen this in the past during holiday periods like Easter or long weekends. And as we look at the move potentially from alert level 2 to 1, we're also looking at the focus of how our testing will look. And since January, as I said earlier, we've done around 282,000 tests, primarily on people with symptoms, and also on close contacts to rule in or out whether they have infection. Now, as we move from alert level 3 to 2, we expanded the testing to include asymptomatic people across New Zealand as part of our efforts to identify if there were any hidden pockets of infection. And over 30,000 such tests were undertaken between the end of April and the end of May, in addition to testing of symptomatic people. And that testing only found one positive result, and that was a worker at Auckland Airport. And it seems probable that infection, this person was asymptomatic, and it seems probable the infection was linked to overseas travel some weeks earlier. So we're at the tail end of that wider asymptomatic testing now, although there are 5 DHBs that have continued that testing over the last week, including the 3 in the Greater Wellington region, Lakes and Bay of Plenty, and then this week Mid-Central District Health Board is finishing off some asymptomatic testing. So the results of that testing are wrapped up and included in our overall public reporting. But over coming weeks, as we move into winter and with the possible move to alert level 1, the focus remains very much on testing of people with respiratory symptoms. So encourage anybody who has respiratory symptoms to seek advice early from Healthline or from your GP or an after-hours clinic on getting a test, and testing is free. There will also continue to be some targeted surveillance testing, and this will be largely focused on the border, but in other places too where indicated. So testing remains a fundamental pillar of our overall elimination strategy, along with our strong border measures and obviously our case isolation and our rapid contact tracing and isolation of any close contacts. Just a reminder though, even though we are in this very favourable position in New Zealand with 12 days of no new cases, There are record numbers of cases being reported globally each day, with around or over 100,000 cases each day. This pandemic continues apace outside of our borders, and we cannot afford to let our guard down. I've had some correspondence from people who have had COVID infections and feel that now that even though they are fully recovered, they are sort of having trouble being accepted as if they are recovered and no longer infectious. And I just want to reiterate that if people are recovered, they have got over the infection, they can go about their daily lives, including attending appointments and going to work and to other places. They are no longer a risk to others. So please do be kind, make them feel part of our society. There is no stigma around having had COVID-19, and we're very fortunate in this country. Of course, we kept our numbers low, and also we had very, very high recovery rates. So I just want to commend to everybody that if you come across people who have had COVID-19 infection, please be inclusive. Just an update on flu vaccination. 1 million doses of flu have now been recorded as having been administered on our National Immunisation Register. That's over 200,000, around 200,000 more than at the same time last season. We've distributed all of our 1.744 million doses of the Southern Hemisphere vaccine and have started to distribute the Northern Hemisphere vaccine that we bought to vaccinate people who may not have yet been able to get the vaccine, and in particular for people who are not publicly funded. And we are very keen to continue to see as many people as possible be vaccinated, particularly those who are at high risk from complications of influenza, that is those over 65, pregnant women, people with pre-existing conditions, and children with chronic health conditions, particularly respiratory conditions. And finally, I was thrilled to see 19 people who work in the health sector formally acknowledged in the Queen's Birthday Honours list, and I'd like to shout out to all those people, many of whom I know, and they're well deserving of the honours they received. I do want to particularly recognise Dr Karen Patazi, who's been awarded Dame Companion of the New Zealand Order of Merit for services to education and the state. And whilst Dame Karen's honour was bestowed for services to education in the state, she also spent 10 years as Director General of Health in the Ministry of Health between 1995 and 2006, and she continues in health as the current Commissioner at Waikato District Health Board. And in my role, I fully appreciate all those who have gone before, and I'm still in regular contact with Dame Karen in her current role and enjoy working with her very much. And other top honours in health were Distinguished Professor Jane Elizabeth Harding, who was also awarded Dame Companion of the New Zealand Order of Merit for services to neonatology and perinatology, and Professor Robert Bob Elliott, awarded Knight Companion of the New Zealand Order of Merit for services to medical research. I'm happy to take questions.
How many tests were conducted in the last 24 hours, and how concerned are you by the lower number of tests over the weekend, granted we are looking at that big move to level 1 next week?
Sure, so the number for yesterday was 1,262. We do see a drop-off over weekends, and particularly on long weekends. I'm not concerned about this because one of the things that's still very clear is if you look, and you can see on the ESR website, they have a dashboard around COVID-19, and it shows as part of that the influenza-like illness, ILI rates, which are still incredibly low across our community, not surprisingly because of the lockdown. And if you compare that with where we were at in the last 2 years, much higher rates by now we would see of people with influenza-like symptoms, and they are the people who would be turning up for testing. Secondly, as I said, we've had quite a lot of additional testing being done over the last 4 weeks or so across the country as part of our surveillance testing, just to see if there were any undetected pockets of COVID-19. We haven't found any, which is encouraging. That testing is tailing off as we now move into our sort of winter testing. I expect the number of tests to start increasing again as people do get respiratory symptoms. And again, just to encourage everybody, seek advice early about getting a test. We want to be testing people, it's free, and we will also be doing some quite rigorous testing around the border of incoming travellers and also of people working at our borders.
When will that testing start at the border, and how will you decide who gets tested?
So that starts from next week. So there'll be two aspects to that. First of all, we're proposing a move to testing everybody coming in to the country who is travelling here, that is New Zealanders returning, not just those going into quarantine. And we're just finalising advice about whether we will test them twice and on which days. So we really want to make sure our border is watertight. And secondly, we will be testing people who work at the border who are clearly at higher risk than the general population of coming into contact with someone who has COVID-19 infection. And that will be more a pattern of sort of surveillance testing just to make sure that there isn't any undetected infection at the border.
After 12 days of no new cases, why can't we just move to alert level 1 today?
So the decision about a move to alert level 1 is one for Cabinet to make. As you know, they're considering that on Monday, and there's been plenty of commentary about whether that decision will be made on Monday. I can't speculate on that, but I will be giving my advice that will be taken into account when they make that decision Monday.
Do you think we're ready?
Well, I think it's very encouraging to have had the 12 days in a row of no cases, and clearly that's what we would be wanting to happen. And so I'll be when we first went into alert level 2, my advice was that we spend a full 28-day, that's 2 incubation periods in alert level 2. Given that what we've seen so far, and if that continues, I'll be certainly reviewing that advice and be giving updated advice to Cabinet. I don't want to preempt what that advice will be, but I think that all the signs are good.
Off the back of your ruling yesterday that the people who attended the protests in Auckland and Wellington don't need to self-isolate for 14 days, does that not make a mockery of staying in alert level 2 if, people can gather in crowds of 2,000 and don't have to protect themselves afterwards?
I don't think my so-called ruling makes a mockery of it. What I would say, though, is that we are in alert level 2. There are restrictions on gathering size for good reason. We are moving down faster and sooner than every other country, and we don't want to lose the advantage we have here. So the restrictions remain. The maximum gathering size is 100, and nobody should be organising or participating in a gathering that is more than 100 people.
And photos have emerged or a photo has emerged of you with what appears to be a lack of social distancing while visiting a restaurant. Are you following your own rules?
Yes, I am actually, and I don't think it's emerged. It's actually been there for a couple of weeks. But yes, this was in level 2, and I visited a restaurant with a group of friends. We were a group of 10 actually. One couple didn't come because one of them was unwell, which was the most important thing. Secondly, at the restaurant, all the right processes were in place, including checking in, single server, seated, and so on. And right at the end of the visit, I was asked to very momentarily participate in a photograph, which is what I did. And of course, we'd all used hand sanitizer, and we'd already registered and signed out in a contactless way.
Isn't the advice to stay 2 metres away from strangers?
Well, I could say that by the end of the dinner, these people were no longer strangers, but it was very fleeting, and it was similar to the photographs I participated in at Government House last week with the Governor-General. Again, very strict protocols followed throughout the evening. Momentarily, the group came together for a quick photo.
I'm interested in the elimination definition. When that last active case comes off the active lists, is the disease eliminated in New Zealand?
So it's a good opportunity for me to reiterate elimination as being an ongoing process and an effort, and it has these pillars which include the strict border measures, the widely available testing, rapid case isolation, and quick contact tracing. So elimination is not a point in time, and I know there has been speculation on when we might be able to say, here is the point we have eliminated COVID-19. It may well be there is no domestic transmission or domestic onshore infections of COVID-19. It would be great if we reached that point, and it's increasingly looking like we are. But our elimination strategy is ongoing because we clearly still have our measures at the border and a desire to open up the border in a safe way.
Can I just quote a part of the website then to you, the Ministry of Health website? It says, elimination does not mean eradicating the virus permanently. Rather, it is being confident we have eliminated chains of transmission in our community for at least 28 days and can effectively contain any future imported cases from overseas. Now, previously, Michael Baker and others have written suggesting you need to provide a clarity on when that 28 days starts. Does it start on when that last active case was in the community? Does it start when they lose the virus? Can you provide that clarity?
Yes, we're just doing some work on that at the moment, actually, and I was talking with the team this morning. I just want to reiterate, it's not we will reach a date and then we have achieved elimination and all is well and good. Elimination is a sustained effort.
Yes.
We will have achieved that point where we have we are confident we have eliminated the chains of transmission in our community. Our ongoing effort remains ensuring we can detect any infections that pop up and that strict border measures.
So
Is
when
there
will
any
you
more
finish?
work?
When will you finish that work, though? Because your own website says there is a date. You just haven't provided the clarity on how to understand that date. And I accept there's public health messaging that you want to get out there to keep people risk-free, but there is a date.
Well, there'll be a date when it's 28 days since we're confident it's the last community transmission. So
From
we
when they were in the community, or when they lost and they were not active.
when the case is considered to have recovered.
Okay.
Yes.
At the border, you've spoken quite a bit about needing to get that watertight. With this new testing, are you confident that's all that needs to be done, or are there other measures that you're looking at?
The testing is supplementary to the ongoing requirement for the 14 days isolation, either in quarantine if someone's symptomatic or in a managed isolation facility. So it's just, I guess, another belt and braces aspect of making sure we've got really good controls at the border. So none of our existing border measures will be relaxed. And in fact, we are also in discussions with Air New Zealand about the possibility of testing of some of their international air crew, particularly the ones coming in from the USA, which in our view is the highest risk place where our crew are travelling to.
Those airline crew, you've spoken about them quite a bit before. Are you getting pushback from Air New Zealand for testing them or quarantining them? We've spoken to you about this for a few weeks now, so why has there been that delay when, as you point out, America has been such a hot spot?
No pushback happening. It's a conversation. I dare say two things are probably taking a little time. First of all, you're aware that there were some significant developments at Air New Zealand last week with a number of layoffs, and so that's been a particular focus for both the airline and the unions with whom we are engaging. Secondly, we're confident in the measures that are already in place for airline crew, Air New Zealand international airline crew. We're just wanting to look at what other measures, including the role of testing and or a period of self-isolation for international airline crew as part of our overall border measures. And so we're just working through that. It's a conversation. It's not us dictating to them what will be.
But shouldn't you be dictating to them? It's a significant public health risk, and it's probably the biggest health risk that we have when we've got such a low number of cases, is these airline staff coming in, not being quarantined and not being tested.
Sure, we can be very clear around what our expectations are, but of course the important thing is that it's implemented effectively, and so it's working through how it can be implemented, and that's what we're doing at the moment. But at the moment I can say we're confident in the measures that are already in place. They've been worked through very thoroughly with Air New Zealand. The current guidelines apply, and we're just again updating them just as we are our testing protocols at the border around anyone coming into the country.
The Minister was to just...
Two quick questions about the border. Are the tests that you're going to be using this regular PCR tests? And another concern has been raised around workers on cargo ships that are visiting New Zealand. What are the sort of restrictions around for those workers? Are they able to come onto New Zealand soil, and should they be tested as well in the same way?
So on the first matter, yes, it's the PCR test, so which is sensitive. It's not an antibody test, so we'll be testing everyone, and we're looking at testing them twice at two different times during the 14-day period. In terms of cargo workers or ship's crews, we're actually reviewing the current arrangements today. We're having another look at that and working with our customs colleagues. There are particular matters to go through around international conventions to make sure we're consistent with those, but we're also looking at making sure that we are watertight around the border in terms of ship's crews coming on shore.
The Ministry of Health admits that its contact tracing data from individual public health units before April the 13th just hasn't been reliable, and it may be revised at a later date. Is the Ministry confident, or are you confident, that the data being provided by those units is reliable at the moment and is meeting your gold standard?
So yes, I'm confident the data are reliable, and it's going to be even more reliable because we're moving them all onto a single information system, or actually 9 of the 12, and the other 3 will need to, their existing information systems in the first instance will need to communicate with the national one. So we will have better quality and more immediately available data. In terms of the gold standard, there are 2 metrics that we're really focused on. One of those is the time that it takes for a test result to be notified, and the second is the time it then takes us to identify and isolate close contacts. And the latter one is particularly important, and that aim there is to get 80% within the 2 days, and yes, we are across the units getting that, achieving that result, so I'm very confident in that, and that's why we've put so much work into improving that. It will be particularly important when we move to alert level 1 to make sure our contact tracing, our testing is very timely and our contact tracing very timely as well.
At the moment, are you running any simulations or anything to make sure that it is all up to scratch if there is a comeback of this virus?
Not right at the moment, but that's something we will do. In other words, stress test the new system.
Would you be comfortable with flights to the Cook Islands and back starting under level 1?
That's something we will definitely look at. I think, and I have said it here before, I think the Pacific, 2 or 3 of the Pacific countries that have no cases, and clearly because their economy is so dependent on tourism, I think there's benefits both ways for us to be looking at opening up our bubble with a number of Pacific islands, and that's work that we're focused on Australia at the moment, but the Pacific, in particular the Cooks, with that direct relationship we have with them as a realm country, and Niue would be another one.
Easier to open up a bubble with the Cooks first because they've got no cases?
It may be, but the focus is on Australia at the moment.
And if Cabinet decided to meet earlier than Monday and sign off, have an emergency meeting as they did during the pandemic, and sign off on level 1, would you be comfortable with us moving there as of tomorrow or the next day?
Well, I have to say I haven't had any word that they were planning to meet earlier, but if I'm asked for rapid advice, we'll get that together. But we're working on it, remembering that the advice will be, it has to date been updated right up until the morning of the Cabinet meeting, looking at all the results in the preceding 24 hours as well.
Longer term, are GPs being asked to look for lingering effects in people who have been cleared as recovered, including respiratory or vascular symptoms?
We haven't asked them specifically, but I know they will be alert to this, and I haven't read any reports on ongoing symptoms that people are having. At this point in time, I haven't had any reported here in New Zealand. Remembering also that because of our relatively low number of infections, a lot of the reports of longer term effects are happening in countries where they've had much larger numbers of infections, so they're much more likely to see this. But I know our GPs here will be very alert to looking for any residual symptoms, particularly respiratory or hematological blood-related ones or cardiac ones.
Of the 17,000 businesses that have printed out these QR codes, how many of them are those sort of high-traffic businesses that the Ministry really wants to see participating?
Look, I'm sorry I don't know that, but we'll find that out and we can follow that up with you.
The Digital Council has published a report today about our digital landscape post-COVID-19, but in it they talk about the COVID Tracer app, saying that NZ could be caught on a slippery slope to mass state surveillance. Do you think the right balance has been struck here in building this app, and are you confident that that's not going to be the case?
I am confident, and yes, I do think we have struck the right balance. First of all, we've involved the Privacy Commissioner right throughout this process from early on and taken on board his advice. He's been involved in discussions here in his office. And secondly, we've been very clear that the information is only will only be used for contact tracing purposes. It's not available to other agencies. So we're doing way less surveillance than most social media platforms are of New Zealanders.
And the Digital Council did say that they weren't consulted on this app. They usually are by the government for these sorts of things. Should they have been talked to about the creation of this?
I don't have a view on that. I'd be interested to see that comment from them, and I can get advice from my team on that.
The Council of Trade Unions is calling for sick leave to be doubled in New Zealand. Do you think that would be a good idea? And what has COVID taught us about the need to stay home when you are sick?
Well, just on the latter point, I think this has been a really key message right from the start. If we've got mild respiratory symptoms, we don't tend to stay home. We tend to get out and about, including going to work. And I think this has been a wake-up call. Most occupations, most roles in New Zealand have good sick leave provisions, and I think that those have been supplemented where in this COVID-19 situation where the government has made it possible for people to take leave either because they are sick or they are a case or a close contact and need to take time off work, and I think employers have supported that. But I think it's a separate issue about longer term whether sick leave provisions should be increased.
From a health point of view, do you think 5 days is ample for a year of sick leave?
Look, I don't have a particular view on that. What I would say is that, if I can speak for the Ministry of Health, we would look at people's individual circumstances, and if they needed more than the 5 days or the 10 days, whatever they were entitled to, we always look favourably on what their situation might be. Final question?
Just 12 days of no cases now. How does it feel to stand up there and announce that when the modelling, showed that we could be in a much different position?
Oh, look, it's hugely satisfying, and just this morning I was participating on a sort of a video call organised by the World Bank, and this was for a group that they had assembled to learn about what had happened in New Zealand, and it was nice to be able to talk about and reflect on the experience here, and also the position we find ourselves in, and also just to reiterate, as I was able to obviously an organisation like the World Bank, that we believe that the actions we took were not just the best thing for the health of our people and our healthcare system, protecting it from being overwhelmed, but also for our economy. Yes, we've taken significant hit in our economy, but it's very pleasing to see that we're now able to come out of our restrictions faster and sooner than other countries, and so I think that's just a really important, because our future well-being as a country will depend on our ability to get our economy going again as quickly as possible. So yes, it's very pleasing to be here, and it's just another opportunity to acknowledge that the reason we're in this situation is that everybody did what was asked of them during that lockdown, and we're now able to reap the benefits of that. Thank you very much for your time.